Hi there, my name is Dr. Bob Marcus, and I created DDS GP. The reason you're watching this video is because you're wondering if DDS GP is a good fit for your office. So I'd like to tell you a little bit about it so you can make that decision. You're thinking about it. We'll come back to that in a minute. DDS GP was created in the mid-2000s when I came to the realization that despite my thorough examinations and my explanations to patients that were in-depth with x-rays and photos and drawings, people were still saying no to treatment more than I'd like them to. I wanted 100% case acceptance, even if the case was large. The larger the case, the more often I've got to think about it. You seeing a theme? What would happen is patients had too much material and not enough relationship. They didn't want to come to me to go to dental school. They decided long ago they didn't want to do that. They didn't want me to be their professor, to use textbook words, to overwhelm them with information. What they wanted was a relationship where we could trust each other, that I'm going to tell them the right thing and they're going to take care of it before it becomes worse. But I needed some way, some tool to use during those explanations that wasn't scary, was quick and efficient to use, and did show what was wrong without going too in depth. So I created DDS GP to use in my own office. Back then it wasn't called anything. It was just an app I created with a bunch of pictures. Well, it grew and grew and grew, and now many dental offices, thousands of them around the world, are using it for their case presentations. I found that when we used it, patients quickly understood what was wrong, they understood the consequence of inaction, and they understood what the treatment was. And then we could make what I call a treatment plan. You probably make those every day in your office, but I'll bet you if you look at your most recent treatment plan, it's more of a list of numbers as opposed to treatments. It's more of a financial plan or a software-driven list of items that patients don't really get. DDS GP creates treatment plans that are picture-based. You can have our drawings that are in the app, thousands of them. You can add your own intraoral photos if you want to personalize it even further. That's a treatment plan. Now, we do have a financial planning worksheet in the app too that you can use to replace your PMS current sheet, which is simpler and more patient-driven. It's easier to understand. So what is DDS GP? DDS GP is the key to having more concise and efficient treatment plans while simultaneously raising case acceptance. And I think every dental office I've seen needs a little bit of that. Good luck. I hope you join the thousands of other dentists around the world successfully using DDS GP. If you need more information to make your decision, please use the Contact Us form. I'm happy to talk to you directly to help you understand if it fits for your office. So don't do what your patients do and think about it. Let's take care of the problem and get your case presentations treated and fixed today.